Hi, so I'm here performing a nasopharyngeal suctioning. So first is I'm gonna wash my hands. Then after washing my hands, I'm gonna dry everything and then wear appropriate gloves. And then after wearing gloves, I'm gonna assess the patient by looking at their vital signs, auscultating, listening to breath sounds, checking the SpO2 and the level of consciousness. And then after that, I'm gonna hear this suction vacuum by turning the regulator and then either turning the knob in what the appropriate pressure for suctioning. So the ideal is within -120 to -150. And then we have here the suction tubing. So first is we have to make sure that there are no kinks on this. No kinks. And then once you're done, we have to check it first if it's functional. So we've noticed that the pressure is goes up. So I think this thing is ready to use. And then we have here the appropriate things that we need to do. So we have the lubricating jelly, and then we have the sterile gloves. I have to fully open this one first. And then the suction catheter, we have to pour this one first with the sterile water. And then with the lubricating jelly, we can either put this one in here with a clean area or with a clean gauze. And then we also have a nasal trumpet. So when inserting the nasal trumpet, by the way, we have to lubricate it with a lubricating jelly. So we'll be able to insert it very smoothly. And then when checking the appropriate size, we can either check this via with the tip of the nose until with the earlobes. And also we can either check it up with opening the nostrils if it's too small or too big. So once we already lubricated this one, we have to insert it gently. We just don't have to be too harsh when inserting this one up. So once you're done, we have to hyperoxygenate the patient with a non-breathing mask. And then once you're ready, have to dispose everything, hand sanitize, and then once we're ready to go, we have to wear it with the clean sterile gloves. Make sure we're able to use which is our dominant hand in doing the suctioning, and then make sure you're not able to touch this on the sides to maintain its sterility. Sorry, the gloves is just too small for me. So, just to be sure. And then we have, because my dominant hand is on the right, so I have to hook this one up directly in here. Sorry. Insert it, and then we have to check, observe if it's functional. So we've noticed noise on it. So before lubricating this, we have to check it first if it's able to drain anything with the sterile water. And then after that, we have to lubricate it with a lubricating jelly in here or with a clean gauze. So after that, we have to insert it just gently inside the patient's nostrils. If we feel a first resistance, that means it reaches the vocal cord, so we have to either let the patient breathe in or able to cough, and also we were able to view it in here. And then once we're able to reach, we have to suction it, pressing firmly this one, and then we should not twist it up like this to prevent any complications. And then when doing this, we have to suction it for less than 15 seconds. And then if we notice there are any secretions going in, and then we have to remove it. When removing this, remove gently to prevent from any splashing of fluids. And then we have to re-sterilize it again. And then when we do this at least more than one time, the ideal is either 2 to 3 times. And then every time we do the second one, we have to hyperoxygenate again the patient, observe everything for the patient, and also once you want to do it again, remove it, and then insert it again with a time of less than 15 seconds. So assuming we're done taking up nasotracheal suctioning, so we still have to peroxygenate it. So the proper disposing this one is we have to